Madalas ka ba nagkakaroon ng pasa nang wala namang dahilan? O di kaya ay bigla na lang nagkakarash ng kagaya nito? Hala, baka Idiopathic Thrombocytopenic Purpura na yan. Tek, ano daw? Idio what? Idiopathic Thrombocytopenia Purpura or ITP. Basically, it is an autoimmune hematological disorder characterized by severely decreased platelet count of peripheral caused by platelet destruction via antiplatelet antibodies, which may also affect marrow megakaryocyte or the cells that produces platelets. So, ano nga ba ang role ng platelets sa katawan natin? Platelets are cell fragments in our blood that forms clots to stop or prevent bleeding. So, madaling salita, the immune system, specifically the T cells, destroy platelets which are necessary for normal blood clotting. Kaya people with the disease have too few platelets in the blood that causes easy bruising, bleeding, and many more that I will discuss later. Now, based on its epidemiology according to Fogarty and Segal, in a recent report, studies confirm that the disease occurs 5 out of 100,000 children per year and that spontaneous recovery is typical, while the incidence in adults is roughly 2 to 4 in 100,000 per year and maybe more in older adults than previously recognized. A female predominance occurs only among middle-aged patients, and there is no racial variation in incidence, meaning the spontaneous remission occurs more frequently in children than in adults. Ngayon, if you're going to ask me, what is the cause of this disorder? Well, I would say that it's called idiopathic for the reason that it arises spontaneously, and the cause is unknown. But there are still hypothetical theories about this. According to Hopkins medicine, medications including the over-the-counter medication can cause allergy that cross-react with platelets. Also, infection, typically viral infections including the virus that can cause chickenpox, hepatitis C, and AIDS, can prompt antibodies that cross-react with platelets. We also have pregnancy, and immune disorders such as rheumatoid arthritis and lupus. We can also add the low-grade lymphomas and leukemias because they may produce abnormal antibodies against platelet proteins. Now, these may all be risk factors, but most of the time, the cause of ITP is not really known. Now, paano natin malalaman if we have acquired ITP? Well, according to Kuwait, the hallmark or most common signs and symptoms of ITP includes excessive or easy bruising, superficial bleeding into the skin that appears as pinpoint-sized reddish spots, also called as purpuric rash because it looks like a rash and it is usually found on the lower legs. Next is bleeding from the gums or nose, blood in urine or stool, unusual heavy menstrual flow for the women, and splenomegaly or the enlargement of the spleen for the severe cases. The common test results for ITP are, first of course, the thrombocytopenia or the low platelet count. Some patients will have a platelet count below 20,000 platelets per microfilter. And also we have this mild anemia, usually secondary to bleeding. The protothrombin time or PT is normal, and the partial thromboplastin time or PTT is also normal. Bleeding time is prolonged. Also, a blood smear to confirm the number of platelets. Then, antibodies are detected. And lastly is bone marrow aspiration, which shows increased megakaryocytes or immature platelets, though this is not recommended at initial diagnosis. At this moment in time, we may be all asking how to treat this. Well, the first and common is the use of prednisone. This is to decrease the body's immune response. So basically, the bleeding will stop even before the platelet counts begin to rise. Next is the use of high-dose IV immunoglobulin, specifically the gamma globulin or IVIG. Then, danazole or synthetic steroid administration is also given. An immunosuppressive therapy, commonly the rituximab, may be used to monitor hypotension, fever, sore throat, and rash. Stem cell transplantation may also be done, and lastly is the splenectomy, but it is not commonly done. Bonus question, Why remove the spleen? In people with ITP, the immune system treats platelets as a foreign bodies and destroys them. The spleen is responsible for removing these damaged platelets, and therefore, the removal of the spleen can help to keep more platelets circulating in the body. That is all. Thank you.